Myself, Dr. Akash Dilip Surana. I practice as a fertility consultant in Navi Mumbai. So in this video, today we will talk about IVF. What is IVF? The full form is in vitro fertilization. So as the name suggests, fertilization means a process in which egg and sperm meet each other, and in vitro means outside the body. So any procedure in which the egg and sperm, we take it outside the body and fertilization happens there, it is called as an IVF. So what exactly happens in IVF? So the treatment, it starts from second or third day of a menses. We call the couple on the second or third day. We do a sonography for the female and we see whether she is fit in that cycle. That means we rule out if she has any cyst from the previous cycle. If everything is okay, then we start giving her injection. These are hormone injection that helps in multiple growth of a follicles. Okay. Normally in each cycle, a female only produces one egg. The benefit of IVF is, in this we give you injection so that multiple egg will grow. That is called as controlled ovarian stimulation. Injections which we give nowadays are all purified or highly purified or recombinant, which are generally given on the abdomen or thigh. These are like insulin injections, so they are not very painful. You need not to come every day to the clinic only to take this injection. We teach you how to take injections by yourself. You can take it by yourself. They are simple injections. As I told, they are insulin-like injections. Now, once the injections are started, we start doing a follicular study. That means a sonography to see how is your body responding to the injections. That starts approximately from 5th day of the injection. It is done on alternate days to see how is the growth of follicle. Once the growth of follicle is optimum, approximately by 18 mm the follicle grows, then we give you a trigger shot, that is an HCG or an antagonist injection that helps in the final maturation of the egg. Once we give this injection, approximately after 35 hours, we remove these eggs outside. Now the removal procedure is called as ovum pickup. It is done under general anesthesia. It's a short procedure, maybe approximately 10 to 15 minutes procedure, for which we give you complete anesthesia. This anesthesia is also given through saline, so there is nothing, no injections from your back like you give in cesarean section. So this anesthesia is given through your saline. Once you are under anesthesia, the way we do a transvaginal sonography, to that sonography a biopsy guide is attached and a small needle is attached. So from vaginally we insert this needle under sonography guidance and we aspirate 1 eggs. So there are no cuts, no stitches on your body in overall an IVF procedure. Once we remove this egg, we take the husband's sperm, and in a normal IVF procedure, we process and we remove only the good motile sperm, and approximately 50,000 to 1 lakh sperm we put around one egg. So naturally one egg goes inside and fertilizes. This is an IVF. Now the advanced form which we normally do nowadays is called as ICSI, that is intracytoplasmic sperm injection. In this what we do, once we take out the egg, at the same time we take the husband's semen sample, we magnify the sperms 400 times and we only select the best of the sperms, and this 1 sperm we directly inject inside the egg. This is called as intracytoplasmic sperm injection. Ultimately only 1 sperm is required for an egg. The benefit of this is we can select the best of the sperm and we can directly inject in it. This is an advanced technique to IVF, which is ICSI. Once this is done, then we fertilize it and then we grow it for 5 days in then incubators. This is called as a blastocyst culture. Once a baby is formed, that is a 5-day baby is formed, it's a microscopic thing. Okay, these are very microscopic. Once the baby is formed, then we put it inside the uterus. That procedure is called as embryo transfer, which doesn't require any anesthesia. It's a simple procedure which is done under sonography guidance. Okay. A small catheter is there called as embryo catheter, which is a small plastic catheter. It's not like an injection, it's a soft catheter. We take the babies in it and under sonographic guidance through vaginal route, we directly insert it in the uterus. So the baby can implant in the uterus. Okay? This is called as an embryo transfer. This overall procedure is called as IVF, in vitro fertilization.